Welcome to another deep dive. Today we're going to be looking into bird flu and, how worried should we be about it?
Oh, yeah.
It seems like it's been in the news more and more.
Yeah, it has.
So we have a couple sources we're looking at. One is from Reddit. It's from the Everything Science subreddit.
Okay.
And the other is from Salon.com. And this article is titled, Concerning Bird Flu Mutations in Louisiana, Patient underscores Pandemic Potential of H5N1. So
Catchy title.
it is, gets
Perfect.
you right in.
It does. So I guess let's just jump right in.
Yeah, let's start with the basics. What is H5N1? What is bird flu? It's a type of influenza virus that typically affects birds, but as you said, it's been in the news a lot lately, and that's because of the possibility of it jumping to humans.
Yeah, and like becoming more transmissible between humans.
Exactly.
That's the scary part.
Yeah.
So it seems like it's not just, a theoretical
Right.
concern anymore. The Salon article mentions 66 confirmed human cases.
In the U.S., just last year.
Wow.
Yeah.
And I mean, are a lot of those mild or, yeah, a lot of them have been mild. But there's this one case in Louisiana that really stands out. A patient over 65 was hospitalized with severe respiratory symptoms.
Oh, wow.
And they found that the virus had mutated within the patient.
Oh, within the patient.
Yeah. The CDC found that.
Okay. So is that like a new mutation, or are those mutations similar to any that have been observed?
Well, that's what's interesting.
Oh.
Some of these mutations actually aren't entirely new. A virologist, Dr. Rasmussen, who was quoted in the article, said that similar mutations were actually observed in bird flu, like almost 20 years ago.
Oh, wow.
So the concern now is that with an increasing number of human cases, the virus just has more opportunities to mutate and potentially become more easily spread between people.
So it's not that there's some new, super mutation.
Right.
It's that it's had a lot of chances to kind of try out different things and
Exactly.
yeah. Okay. So that brings us to, the Reddit anxieties that we're seeing. A lot of users on that Reddit thread were talking about, respirators and, stocking up on supplies. And
Yeah. It's understandable. I mean, after COVID, I think people are just kind of on edge about these things.
yeah, for sure. So, what do you think about respirators? Are they a good idea?
Well, respirators can be very effective, but the key is proper fit.
Ah.
So whether you're using an N95 or a P100, if it doesn't fit right, it's not really going to do much.
So even if you, buy the top of the line, if you don't know how to wear it properly.
Exactly. It can render even the best respirator useless.
Got it. Okay, so that's something to keep in mind.
Yeah.
Also on Reddit, there was a lot of talk about vaccines. Some users were concerned about, how effective they might be or potential side effects. Others wondered if it would even be available to everyone if it was developed.
That's a valid concern for sure. I mean, we saw with COVID that vaccine hesitancy and just access in general can be a big hurdle.
Yeah, and actually one commenter pointed out that during COVID, in their state, wealthier people were kind of the first to get the vaccine.
Oh, really?
Yeah. So there's concern that that would happen again.
Oh, yeah, for sure.
If a bird flu vaccine came out, that it wouldn't be equitable.
Yeah. It's definitely something to think about.
So Dr. Nguyen, who was also quoted in the Salon article, had some pretty strong recommendations for preparing for a pandemic. She stressed the importance of having tests readily available.
Okay.
And also a preemptively approved H5N1 vaccine.
Even though there's not a widespread outbreak among humans yet.
Yeah. She's like, let's just
Be ready.
be ready. Yeah. Better safe than sorry kind of approach.
I think it highlights the importance of being proactive.
Sure.
Having those tests and vaccines ready to go before they're urgently needed could be really vital in containing an outbreak if it occurs.
Okay. So and the article did mention that there are a couple of H5N1 vaccines that have already been developed.
Yeah.
So I guess it's more about getting them authorized and,
And distributed effectively
Yeah.
if and when it becomes necessary.
So we have the tools, we just need to
Right.
be smart about it.
Exactly. And that brings us to another important concept, reassortment.
Reassortment. Okay, so
Have you ever heard of that?
I've heard of it. I don't know if I could explain it though.
Okay. So reassortment is basically when two different flu viruses infect the same cell and they can swap genetic material
Oh.
and create a new hybrid virus.
Oh, wow.
Dr. Rasmussen, that we talked about earlier, described it as like shuffling two decks of cards together. You get all these new combinations.
Okay.
And so in the case of viruses, this can result in really rapid and unpredictable changes.
So a bird flu virus could potentially mix with like a human flu virus, then
Exactly.
create this like hybrid super.
Yeah, and it would have a much greater potential to spread among humans.
Yeah, that does sound unsettling.
Yeah, it definitely highlights the importance of those proactive measures like having the tests and vaccines ready to go.
Okay. So the Salon article also touched on, the political landscape a little bit. Dr. Adolja expressed some concern over how, like, the incoming Trump administration might handle, like, the situation if it were to escalate.
Yeah, they did mention that. Um, and of course, we're just reporting on what the article said. We're not endorsing or criticizing any political position.
Right.
But, effective pandemic response often depends on, government policies
Yeah.
and public health measures.
For sure. So it's not just about the science, it's about, like, how we respond to the science,
Exactly.
socially and politically. Okay, well, we've covered a lot of ground here. We've talked about, kind of the basics of H5N1. We've talked about, that concerning mutation in Louisiana, and kind of like the public anxieties around it and the importance of vaccines and testing.
Hmm.
So before we move on, I want to ask you, the listener, what steps, if any, are you taking or considering taking to prepare for a potential bird flu pandemic?
Yeah. Let us know what you think.
Yeah, we'd love to hear your thoughts.
For sure. We'll be right back. It really is a lot to think about. Going back to those Reddit discussions, it seems like people are already, taking this threat pretty seriously and thinking about how to protect themselves.
Yeah, some of those Reddit comments were really eye-opening. One user, Jurassic Park, mentioned having like personal experience with pandemics. They caught the swine flu back in 2008, and they said they're terrified of bird flu and had already bought a respirator.
Wow. That personal experience, definitely shapes their perspective.
Yeah.
It's interesting how past outbreaks can really influence how we see current threats.
Yeah.
And, it wasn't just them. A lot of other users were echoing those anxieties and, asking about respirators and things like that.
Which brings us back to Dr. Wen's recommendations. Besides that, preemptively approved vaccines, she also talked about readily available testing,
Right.
especially for people who work closely with birds, like farm workers.
Yeah, that's a really important point. I mean, we saw during COVID how like limited testing capacity really hurt our ability to, track and contain the virus. Early detection is so important.
Yeah, she seems to be advocating for a much more proactive approach. Like, don't wait until it's a full-blown outbreak.
Exactly.
Let's just get ahead of this.
And it's not just about, having the tests. It's about making sure they're accessible to the people who need them.
Right, right. And speaking of access, there was a comment on Reddit that brought up a pretty sensitive issue. A user brought up the topic of undocumented farm workers and how they might be more likely to accept a vaccine because of, their status.
That's a really complex issue. It highlights the need for public health policies that are, inclusive and address the needs of everyone, regardless of, background or status.
Absolutely. Access to healthcare, including vaccines, shouldn't be determined by, someone's circumstances.
No.
So far we've been focusing on the U.S., but obviously bird flu is a global issue. The Salon article didn't really touch on the potential international response. What lessons have we learned from previous outbreaks like COVID or even the 2005 bird flu outbreak that could inform a global strategy?
Well, one of the biggest takeaways from these recent outbreaks is the need for international collaboration.
Right.
Sharing information, coordinating those surveillance efforts, and just developing strategies together is going to be really crucial in containing a global outbreak.
Okay. So it sounds like a coordinated global effort is essential. What about travel restrictions? I mean, would we see like border closures and lockdowns like we did during COVID?
Oh, that's a tough question. Travel restrictions can, help to slow the spread of the virus, but obviously there are significant economic and social consequences to that. Finding that right balance is, it's a challenge.
Yeah, it seems like there are no easy answers when it comes to pandemic preparedness. It's this complex interplay of, scientific factors and public health measures and individual choices.
Exactly. And, it kind of brings up another important question. How do we effectively communicate risk, and encourage preparedness without, like, causing undue alarm?
Yeah, because if everyone runs out and buys a respirator because of something they read on Reddit, then we could have shortages for healthcare workers.
Exactly. We saw that happen, with masks and hand sanitizer at the beginning of COVID.
Right, right. So clear, accurate, timely information from trusted sources is just so important. And it's not just about understanding the virus itself, but, understanding what practical steps people can take to protect themselves and their communities.
Yeah, and those messages have to be delivered in a way that, it informs and empowers people, but doesn't fuel that fear and panic.
It's a tough balance to strike.
It really is.
So it seems like we have a lot to consider both on an individual level and, from a global perspective.
Yeah. We're all interconnected in a lot of ways, and the choices that we make, both individually and collectively, are really going to shape our response
Yeah.
to this potential pandemic.
Absolutely. As we head into the final part of this deep dive, I'm curious to hear your thoughts on something we haven't discussed yet, which is the potential economic impact of a bird flu pandemic.
Right. That's a big one. Let's dig into that in the next segment.
I mean, thinking back to those early days of COVID, the economic disruption was like crazy. Businesses shut down, supply chains were all messed up, and tons of people lost their jobs. Could we see something similar with bird flu?
It's definitely a possibility. Pandemics can have a huge economic impact. And it's not just about healthcare costs, treating the sick. It's about how it affects all sorts of industries.
Yeah, like travel and tourism got hit hard during COVID.
For sure. And then there's the potential for disruptions to global trade and all those supply chains like we saw before. Everything's so interconnected that a problem in one place can really snowball.
So it's not just about personal health, it's about preparing the economy to be more resilient too.
Exactly. Governments, businesses, individuals, we all have a part to play in getting ready and, minimizing the potential damage.
It's like we're trying to walk this tightrope between being cautious and prepared without, freaking everyone out. How do we stay informed and take action without getting lost in all the worst case scenarios?
Right. It's a tough balance.
Yeah.
I think it comes down to finding those sources you can trust, keeping up with the latest information, and making smart choices based on, solid evidence. And it's about having these conversations, talking through the different perspectives and really weighing those risks and benefits.
Yeah, definitely. This has been a really fascinating deep dive. We've covered so much from the nitty-gritty science of those mutations to the bigger picture stuff, like how society and the economy could be affected. It feels like we've just scratched the surface.
Oh, there's always more to learn.
Yeah.
But I think we've hit on some really important points. Those mutations in Louisiana, that's a reminder that this virus is changing all the time. We have to be on our toes and proactive.
Absolutely. And we can't forget about working together as a global community, communicating responsibly and making sure everyone has access to the resources they need, like those tests and vaccines we talked about.
Couldn't agree more. Those are all critical pieces.
So to our listeners, we'll leave you with this. Our sources really focused on the U.S. side of things, but this bird flu isn't just an American problem. It's a global challenge that needs a global response. Stay informed, talk about it, think critically, and take those steps to protect yourself and your communities. That's how we prepare for whatever comes next.
Well said. Thanks for joining us on this deep dive.